Greetings, my name's Joe Macbeth, and I am the Chief Executive Officer at the National Alliance for Direct Support Professionals. Thanks for watching. So here we are. I don't know who could have predicted this situation 2 weeks ago, that we would find ourselves socially distancing ourselves and the chaos that the coronavirus has caused on the disability support system. And I know all across the country, direct support professionals are struggling and sharing their struggles with us through social media. But I also know that their organizations and their employers are struggling just as much. And the NADSP wants to provide this system with some tools, some practical tools to help get through this crisis. And the crisis will end. And we'll come out on the other side with some really good information and ways to improve it so it won't happen again. But what I do know, that this coronavirus has caused massive amount of layoffs in other businesses, in other industries. Two of my kids who work in the restaurant business are now laid off and looking for work. And I think a whole lot of people are going to be looking for jobs. And not unlike 2008, when we hit the Great Recession, people who are looking for jobs come to the disability service sector because we have jobs. They may not stay when the economy gets better, but we do know that a lot of people are going to be looking for work, and we're looking for work fast. And I also know that given the current situation, the provider community is in crisis, and we're looking to hire people fast. And I also know that some of the regulations to onboard people may be waived. We may fast track a lot of criminal background checks to get people hired quicker. And in a crisis situation, I think that is completely reasonable. That said, however, what I know and what the NADSP knows about the direct support position is the better the relationship between the direct support professional and the people that they support is, the longer that we know each other, the better the relationship, I think the better the outcomes, the better the services are. And in a situation like this, when direct support professionals may be out sick or may be home with their families, and that crisis happens, then we're going to be bringing people in who may not have those relationships. And in the terms of onboarding new direct support professionals, I think a lot of the required trainings, the CPR and the first aid and the incident reporting and the bloodborne pathogens, that's going to continue to happen, and that's good. But what we know about direct support professional practice is that that's not good enough. We need to focus on the competency areas and the ethical responsibilities of the workforce, and a couple of other things. So what we're going to be rolling out in this toolkit is helping organizations onboard people and giving them access to our Code of Ethics webinar series. There's 10 very short webinars that includes the 9 tenets of the Code of Ethics and one webinar on the preamble. And I think that's a really good primer for new direct support professionals to understand the Code of Ethics. And frankly, if you're providing direct support, the Code of Ethics is critically important. We are also going to be sharing links to a series of webinars on the 15 NADSP competency areas. These are what we call lunch and learn. They've been recorded last year. They're archived. We're making those available to the field. 15, 20, 25-minute videos about the competencies. So these new direct support professionals that are coming on board will have their required trainings, but will also have access to the Code of Ethics and the competencies. It is not ideal, and let's face it, we're working in unideal situations, but it's something, and we want you to use them. The other things that we're going to be releasing is we worked with the New York State Alliance for Inclusion and Innovation a few years ago, and we created a realistic job preview. The realistic job preview should be used by organizations who are looking to hire new direct support professionals. And it gives a prospective DSP a complete understanding of what the job is, the good and the bad, the challenges and the rewards. And there's many challenges, especially these days, but there's also some incredible rewards. And we want you to use this realistic job preview and to help people who are coming to look for jobs a good opportunity and a sound idea of what this job is, so they can decide on that spot. After they see that video, this may not be a job for me. And trust me, you want them to make that decision then, rather than after they started working with the people that you support. So they know it before they sign that dotted line. Use the RJP. We will also be sharing with you some other resources, like a job description that includes the ethics and the competencies, just to get you started. We know there's going to be an influx of new people doing this critically important job. And we want to help organizations, provider organizations, with some relief. That's for the provider organizations. Later this week, maybe early next week, we also know that direct support professionals themselves, incumbent DSPs, who are working a lot of hours under a lot of stress, they need support. They need help. And we're going to be offering a toolkit, including a webinar with our Director of Educational Services, John Raphael, who is a licensed social worker, to help people deal with that anxiety. Our direct support professionals are often called these unsung heroes and the backbone of our field, and that's all true. But we have to make sure that after we get through this, we have some serious conversations about, then let's start treating them as such, let's recognize them as such, and let's pay them as such. Those are conversations down the road. This week, early next week, helping organizations onboard a new influx of direct support professionals and giving the incumbent direct support professionals some tools to deal. I often say that the direct support job, the direct support professional's office is in the community. Well, as of this week and the coronavirus, that's no longer true. The direct support professional's office is where the people live. And sometimes when we're working with people who may not understand why their regular routine is being disruptive and why we can't go out to malls or to restaurants or to concerts. Why? Well, we need to work with that. These are uncharted territories for our system. And we'll get through it. And the National Alliance for Direct Support Professionals is committed to helping organizations in their onboarding new direct support professionals, and we're also committed to the incumbent workers to make sure that they are safe and happy. From the bottom of our hearts, we thank you all, the provider community, the direct support community, the social service system, the health care community. This is unprecedented, and I think that you will see that we are here for you and to help you every step of the way. So stay tuned. Visit NADSP.org for more resources. Again, these videos and the webinars are going to be shared with you in a very easy to find, click and watch, and share it with your workforce. Share it with everybody. Thanks so much. Best to you all. Stay safe. Wash your hands.